How to safely clean earwax cerumen from your ears. Earwax cerumen is a natural substance that helps protect the ears by trapping dust, dirt, and bacteria. In most cases, the ears clean themselves as earwax naturally moves out of the ear canal. However, sometimes excess earwax can build up, causing discomfort, hearing problems, or even infections. Cleaning your ears properly is essential to avoid damaging the ear canal or eardrum. 1. Safe methods to clean earwax at home. A. Use a damp cloth or tissue for outer ear cleaning. 1. Soak a soft cloth or tissue in warm water and wring out the excess water. 2. Gently wipe around the outer ear, pinna, and entrance of the ear canal. 3. Do not insert the cloth or tissue inside the ear canal, as this can push the wax deeper. B. Use earwax softening drops. Earwax softeners help loosen hardened earwax so it can naturally drain out. You can buy over-the-counter ear drops or use natural alternatives. Common earwax softeners include 1. Hydrogen peroxide, 3%. 2. Mineral oil. 3. Baby oil. 4. Glycerin. 5. Saline solution, salt water. How to use. 1. Tilt your head so the affected ear faces upward. 2. Use a dropper to place 2 drops of the solution into the ear. 3. Stay in this position for 5–10 minutes to allow the drops to soften the wax. 4. Tilt your head in the opposite direction to let the wax drain out naturally. 5. Wipe the outer ear with a clean tissue. C. Irrigation, ear flushing with warm water. Ear irrigation helps remove earwax that has been softened by eardrops. How to do it safely. 1. Fill a bulb syringe or ear irrigation kit with warm, not hot, water. 2. Tilt your head to the side and gently squirt water into the ear canal. 3. Keep your head tilted for a few seconds, then turn your head the other way to let the water and wax drain out. 4. Dry the ear with a clean towel. Warning: do not use this method if you have an ear infection, eardrum perforation, or a history of ear surgery. 2. What not to do when cleaning your ears. Crossmark: do not use cotton swabs, Q-tips. 1. Cotton swabs can push wax deeper into the ear canal, leading to blockages. 2. They may also damage the eardrum and cause infections. Crossmark: do not insert sharp objects, hairpins, keys, or pens. 1. These can scratch the ear canal or puncture the eardrum, leading to hearing loss. Crossmark: do not use ear candling. 1. Ear candling involves inserting a lit, hollow candle into the ear. 2. Studies show that it is ineffective and dangerous, as it can cause burns, earwax blockage, and perforated eardrums. 3. When to see a doctor for earwax removal. Seek medical attention if you experience 1. Hearing loss or a blocked ear sensation. 2. Pain, itching, or discharge from the ear. 3. Dizziness or ringing in the ears, tinnitus. 4. A history of frequent ear infections. Doctors may use special tools, like a curette or suction device, to safely remove stubborn earwax. By following these safe cleaning methods, you can keep your ears healthy without causing damage. Ambulance ear sparkles.